Good morning, everyone. I'm very excited to say that today we have Chantal Dupuis with us. She is the Mental Health Lead and Program Analyst from the OPP Community Safety Services. Today's session is actually sponsored by the OPPVA, Chapter 18 Aurelia. So thank you very much for making this event possible. We also have Midland Honda and Brissette Concrete and Forming, who have made this entire week possible, and they will be sponsoring our mental health, Get Your Mental Health in Motion, Choose Your Own Adventure this Saturday. So for the link to that, we have the donation link for the COVID-19 Mental Health Relief Fund in the chat, and we will also put a link to register for our Saturday event. All of the sessions are free, but we do encourage any donations, and thank you so much for your support. I also want to thank everybody who showed up today, and we do have a number of people who will be watching these sessions afterwards, so we will be making them available on the Waypoint YouTube channel, so please stay tuned for that. Before I hand it over to Chantal, I'm just going to give you a little bit of background on where Chantal has been in the last few years and what she'll be speaking about today. So today's session is actually looking at mental health in the community and the OPP mental health strategy. So this will be a great session to learn a little bit more about how that connection between mental health and the OPP works and the support that they provide. So Chantal is from the North Bay area and has over 20 years of experience as a frontline nurse. She worked at Ontario Psychiatric Hospital. She worked in the acute inpatient psychiatry units. She has experience with the regional court diversion, discharge planning. She also has experience with the mobile crisis unit in the North Bay area. And she is the previous chair of the North Bay Situation Table. So we are very lucky to have Chantal with us here today. And I will hand it over to you, Chantal.
Good morning, everyone. I'm happy to be here with you all this morning. I'm going to share my screen, and you'll have to forgive me. I am working from home and am not the most techie individual. So I'm just going to, just bear with me. I think I may need, do I need permission granted to me to share my screen?
Yeah, we'll just double check you have that.
I think you might have to give me an authority to share my screen. Is that?
It's already set up so everyone should be able to share.
Just bear with us here for a moment. So I have my my PowerPoint pulled up already. Just looking for where I can do that.
It should be just at the bottom of your screen. There should be a little green highlighted item with it's a square with an arrow pointing up that says share screen just at the bottom of your page.
Yeah. Oh, I see. Sorry, my apologies. I didn't have it on full screen. Okay, so can everybody see this? Can you tell me, Shelley, when that comes up? Okay.
Hi, it is up.
Yeah, it is up. Okay, and I don't know how to hide my my speaking notes. Or can you see them?
We can't see them right now, but you did have them up before.
Yeah.
There they are.
Yeah. How can I hide those? Anybody quickly know how to do that? So it's not distracting.
Rebecca, do you know? She might just be checking for you.
Okay. Well, I'll get started. So thank you for that introduction. And when please interject when you have the information about how to get rid of these speaking notes. So my name is Chantal Dupuis, and I am fairly new to the OPP. I've been with the OPP for about a year now as a program analyst and mental health lead. My colleague Lisa Longworth was the first subject matter expert to join the OPP from the healthcare sector, and we'll get into that a little bit later. So I'll try and keep this a little interesting. I mean, I could kind of drone on quite a bit today about all of the work that we've done, but I'm really proud to be part of an organization and a police service that has taken such strides towards implementing their mental health strategy. So this slide here just highlights some of the work that the OPP has done since the launch of their, the release of their mental health strategy, Our Communities, Our People. So this obviously predates my employment with the OPP, but just provides you with a sense of over the last 3 years, we've come leaps and bounds. And in 2017 is when my colleague Lisa Longworth from the healthcare and primary sector was hired with the OPP to start implementing strategies and projects to move forward with their mental health strategy. I think that's so speaks volumes about the OPP's commitment to the mental health strategy and to mental health issues, period. As mentioned, the CSS falls under field operation supports and is under the purview of Deputy Commissioner Chris Hawkins, who really is committed to improving mental health across the OPP for our communities. Anybody, have we come back to me with any kind of tips on how to get rid of the speaking notes?
I think if you look in that little red area and you tap on notes, you might be able to hide them. Do you see at the bottom right there?
Whereabouts, sorry?
So it's on the very, I see a red bar, like line at the bottom of your screen that's being shared with us? Yes, I think right there. And you see notes? Yeah.
Yeah.
Perfect.
That's better. That's better. Does that improve the quality like of the screen?
Yes, it
Yes,
gets
it does.
We no longer see your notes.
Oh, perfect. Thanks, everyone.
You're welcome.
Obviously, I need to take some, go back to school and take some I call them techie courses. I'm a social worker and nurse by trade. Certainly, this is definitely outside of my my comfort zone. Okay, so we're moving on to the next slide. So it's important to note, moving forward, you'll maybe have seen some documentation with the OPP that refers to mental health only. With the work of our community partners, our sector, our support team sees the importance of including addiction, the word addiction. So we are now moving towards mental health and/or addiction in all of our language, and we hope to embed that in our policy that we're updating and in our mobile crisis teams, our police hospital transition work. And when the OPP embarks on an updated strategy, our hope is that we can include the language mental health and/or addiction in all of our future work. So this slide is just drilling down here some specific examples of where some of the issues that we intersect with our mental health and addiction partners. And I will elaborate on these as we go through today. Some of you, like for example, the top opioid working group, some of you may have seen in Cineplex theaters last summer across Canada, the Good Samaritans Act. That was our team that developed that as an internal and external campaign to support life-saving measures in an overdose situation. That's just one small example. I'm sure that most of you, I'm hoping that some of you know what situation tables are. We provide, we're the only police service to provide free comprehensive training and refresher training annually. We'll get into police hospital transition work a little bit later. So these are just some samples as to how we intersect with mental health and addiction partners. And while the OPP intersects with all provincial governments, we particularly, this one here, we're going to highlight for today the work that we have done with the Ministry of Health partner, which obviously entails the mental health and addiction work of our portfolio. So just to name a few, the OPP is currently involved in a provincial working group for the development of a framework and toolkit on mobile crisis response teams. We're involved in a community of practice with the GTA. We've had conversations with the Ministry of Health around funding allocation supports, where we were able to share with them certain communities that were in states of readiness to receive and to move forward with certain projects. We've had joint conference presentations. For example, CMA recently, the OPP and CMHA Ontario did a joint presentation for CIT International, that's Crisis Intervention Training International. There's an annual conference. So we have done collaborative conflict resolution with the Ministry of Health, lots of a community of practice in the north around mobile crisis response. So that's just to name a few. I could probably go on and on. So the structure of CSS Support Team, we'll elaborate as I go about today. So to start, we have 2 mental health leads, myself and Lisa Longworth. We have regional mental health coordinators and detachment mental health liaisons, and I'll elaborate a little bit more as we go on today. And this is basically the structure of our mental health work and how it flows within the organization. So these are some of the projects that CSS as a whole has worked on over the last few years. But again, for today's purpose, we'll really focus on mental health and or addiction work. But if anybody at a later time is interested in some of these topics like seniors abuse and our seniors resources, abuse issues, I'd be happy to connect you with one of my CSS partners. The CSS team is comprised of 2 research analysts, 2 mental health leads, a sergeant and a staff sergeant, Julie Randall. So these are some of the projects that are ongoing within our department. So the mental health leads were hired from the mental health and addiction sector. Lisa Longworth is a full-time employee, and myself, my position is still a contract position. Of course, it always comes down to funding, but we provide field operations support to all levels within the OPP, so from detachment commanders to frontline staff, amongst other bureaus, such as the Healthy Workplace team. So here we have the regional mental health coordinators. Again, the OPP is divided into 5 regions, and each region has a mental health coordinator who is an officer that kind of works with the mental health leads to disseminate and to coordinate things like training. Perhaps they may be able to provide immediate support to the detachment commanders. And then every detachment has a mental health liaison who's acts as a champion for mental health. And the hope is that they are really connected with the mental health community, so that when they have, say, an individual within the detachment geography that requires to be, supported and connected, that they have those connections and that knowledge of what resources are existing in their community. So, and oftentimes the mental health liaison officers are the dedicated officers to a mobile crisis response team, and often as well, they are the officers to attend a situation table. So here we're going to talk about the training. So some of the training that the mental health first aid is training that's provided to every officer within the OPP. To date, over 4,000 members have been trained. This was a partnership with the Mental Health Commission of Canada, and the OPP was a pilot in this development and implementation, and continue to roll this training out annually. It is a mandatory training for all officers. The OPP crisis intervention training was adapted from the Memphis model to include all critical key components of what they consider best practice. It's a 3-day train the trainer model. And we are committed to the continuous evolution and updating of the content, and currently are reaching out to an advisory group to the OPP to ensure that we're delivering the most current, up-to-date material. In keeping with the traditionally the OPP trained only officers, but with a recent project in the East region, I think it was, the OPP invited all first responders, such as paramedics, fire department, emergency department nurses, so members of their community who are first responders, to train together. So this is a recommended best practice from CIT International, and we hope to move forward in this, excuse me, in this way, as it does provide it builds capacity within the organization and within the community for, shared learning, and builds positive relationships within our communities. I'm just going to take myself off camera here. There we are. Then I'm not distracted by looking at myself. So the INDRI Brief Mental Health Screener is so INDRI is a collaborative network of researchers and practitioners from over 35 countries. They are committed to improving care for persons who are disabled or medically complex. Our organization wants to, strives to promote evidence-informed clinical practice and policy decision-making through the collection of really rich analytics for positive outcomes for persons served across a variety of health and social service settings. So the BMHS was created for frontline police, and it's based and intended to complement INDRI mental health assessment system for inpatient psychiatry, INDRI community mental health assessment system, and INDRI emergency screener for psychiatry. Again, it's developed to assist frontline officers and to respond to individuals with mental health concerns in our communities, and it's designed as a brief screener only. And we at the OPP do get some really rich data from the BMHS. It was rolled out across the OPP in 2015, and recently was deemed best practice in the police hospital transition framework. It's definitely an evidence-based tool that helps us collect and analyze data from our mental health occurrences. It does fit into the hospital and psychiatric service INDRI suite of tools. And a lot of hospitals aren't aware of this when we come to the table, but we're able to provide to support awareness and education. It's one of the jobs one of the portfolios that Lisa and I do is that we provide that information. And once hospitals have that information, they're more open to receive and work with the OPP when it comes to our police hospital transition work. It does also help to identify, identify peak times for our mobile crisis response teams. The data helps to also provide, it helps us with the waiting times in the emergency departments. It's a communication tool for joint risk analysis. So lots of good things coming out of from the brief mental health screener. I know I've spoken about the police hospital transition quite a bit. I don't know how many of you are familiar with this work. Prior to 2019, the OPP had attempted to establish transfer of care agreements with limited success. In 2019, the OPP actively participated in the release of the police hospital transition, a framework and toolkit for Ontario. This framework was developed by a large working group that comprised of Ontario Hospitals Association, members from the Ontario Police Chiefs Association, CMHA Ontario, to name a few. And the joint, this framework was released in 2019. Since this time, the mental health leads at the OPP have developed a toolkit for every detachment to include resources that are based on the recommendations from the framework. So we've adapted an MOA, privacy considerations, terms of reference that were all just kind of mirrored from the framework that was released. I think, oh, I wanted to just highlight that recently there was work done on over the last several months in an area, an OPP area, where they there were 6 police services and 3 hospitals and an MCERT team that includes joint training for frontline police and hospital staff that all signed one MOU for the police hospital transition work. So that was a really big moment for the OPP and a very successful endeavor. This slide kind of highlights just the some of the suite of tools. This can be found on our intranet, our internal intranet OPP page, and it's some key messaging, and you'll see here some of the tools that were created for our detachment commanders. So a process guide, terms of reference, MOA, some appendices that are really, been proven to be very helpful for our detachment commanders. This brings me to mobile crisis response teams. Here, so prior to 2015, we would hear the words collaborative response model, where police were leveraging existing community mental health and addiction partners to call crisis support workers to a scene or to follow up with an individual who is suffering from a mental health and or addiction related crisis. They may have consulted over the phone with the health professionals. This is a less formal model where there's probably less to little no face-to-face response with the health partner, but typically was an after the fact. So this map just sort of highlights the parts of Ontario that may still have a collaborative response model. You'll see these most often in really small rural northern communities where resources are really limited, or geographically they're just too, the detachments and communities and service providers are so far apart from one another in distance that it makes having a mobile crisis like a traditional MCERT less feasible. But we continue all the time to strive to create alternate options such as mobile crisis response, and we try to, where possible, provide other resources like Connects Go, and we're always helping the detachment commanders to create partnerships with their community partners, even if what we consider the Cadillac model of mobile crisis, even when that's not possible, we're constantly, like I think of Perry Sound comes to mind, they at this time don't have the partner, they have a partnership, but they don't have all the resources and necessary to create a mobile crisis response team, but they have a collaborative partnership with their health partner. This map highlights the implemented teams, MCERT teams. There's a variation of names, partners, operations, times of operation, the types of models, and different funding sources. Quite frankly, we know there's no cookie cutter approach. However, in 2019, the OPP did engage with community partners across the province to establish a provincial working group to develop a framework and toolkit for mobile crisis response, with the goal of providing existing literature review, like of doing an environmental scan. We were looking for better understanding, universal considerations and tools for this work. There was very little work done in the province or in North America in terms of best practices, and little research done. So we brought together a working group, and the goal is to develop provincial core components and common approaches to collect data, evaluate these teams, and begin to evolve towards clear evidence-based practices. And since this map was created, there have been several teams added. Like I know I primarily provide support to the northeast and northwest parts of the province, and I can say that I believe there have been 4 new teams added to this map since it was created. This map highlights the teams that may be in the development stages. And again, Lisa Longworth and myself, the mental health leads, are in constant communications with our detachment commanders and their health partners to help develop coordinated efforts and common approaches. Sometimes it's mediating conversations where there may not have been a relationship prior. So I find this work very rewarding, especially that I was a clinician on a mobile crisis response team, and I have the advantage of having both perspectives from the healthcare partner side and from the policing side. This is also found on our OPP internal intranet page. It again provides some key messaging. We developed a suite of tools to assist detachment commanders with their partnerships and the development of teams. We include a funding like a funding proposal template if they don't have funding from their local LINs. I think here it's also important to note that one of the things the OPP has done based on the anticipated guidance from the provincial working group is we started to qualify our teams. And so some of the key language that we're using now and starting to, which will help us to have a real fulsome evaluation of our teams moving forward, is language like embedded, dedicated, ride along, co-response, live, follow-up, etc. So we've started to really qualify what our teams, what kind of teams that we have, and that'll allow us to do, again, like a very fulsome evaluation. We're also, on that note, it won't be long before mobile crisis response team, so MCERT, will be on niche RMS to allow us, again, to collect really great data as to when these teams are utilized and mobilized. I won't spend a lot of time on these slides, but they just kind of highlight, so it highlights some of the existing mobile crisis response teams within all of our districts, our regions. So here, you'll note that, for example, I'm just going to look at, this is the Northwest area. So you'll see, like, for the district of Kenora, they have annualized healthcare funding. So from their LIN, they have a youth dedicated team, which has been well established for a few years. And then they have 2 adult teams, mobile crisis response teams. One is already established, and the second is in the development stage. So, and then you'll see that Dryden has no funding, but they have just realigned their relationships with their health partner and their municipal police service, and are working together on a joint response model, though they don't have any new funding for a dedicated health partner or dedicated officer. I'll just sort of, like, this is the northeast part of the province, and then again moving down, this is the central west region. And I think that it's important to note here that the OPP has a highway safety division, which includes several detachments along the 400 series. So while they may not have funding or a mobile crisis response team, they they still may have times where they need to be able to collaborate with a mobile crisis team. To consider, the Highway Safety Division PMHS data indicated that the entire HSD region saw 175 calls for service for mental health and or addiction related occurrences in 2019. There's a lot of risk having a mobile crisis team attend roadside calls. However, we continue to seek opportunity from nearby MCERT teams like Niagara Coast or MCIT Durham, Waterloo, Wellington Impact, and we're able to create partnerships and addendums to our existing with their mobile crisis teams to, in the unlikely event that we require service, for them to come out and support our officers or to meet our officers in the emergency department of the nearest hospital. So we have created partnerships like that across the province. Currently within the Sudbury area, that is occurring. Where Greater Sudbury Police is working on establishing a mobile crisis team, and they want to be able to provide support to the OPP and their surrounding highways, the surrounding areas that the OPP provides support to. And so those are great partnerships that are new within the OPP and happening across the province. I realize I've probably skipped through quite a few slides a little bit quickly. I've almost concluded my presentation. I'm just kind of going to go back and see if there's anything that I've missed.
So we do have a couple questions that people sent in, and
yes.
There are also a few questions that we had just around the situation table and maybe walking us through what an interaction would be like in the community that the OPP would be involved with, like giving people an idea of what the start to finish process would look like in terms of the first interaction and the follow-up.
Oh, great. I can't see the chat, any of the chat, so that's great.
That's not in there. I will post it in a second. I'm just
That's okay. So your question is in regards to mobile crisis or situation tables? Oh, I'm sorry, I can't hear you. Say it. I'm sorry. Say it again.
Go into a little bit of detail about what the situation table does.
Oh, yes, of course. Okay. So a situation table, and I kind of thought that earlier when I mentioned it briefly. I'm not sure if the audience is familiar with the situation table, but it's basically it's a model of intervention that comes from Scotland originally, and then was adapted by Saskatchewan, and then kind of swept across the nation, and particularly Ontario. In fact, I did skip through a stat over when I talked about situation tables, but I think the OPP sits on 59 situation tables out of 73 in the province. And so it's a group of community social service workers or community social service partners, such as Children's Aid Society, school board representatives, municipal and or police OPP representatives, perhaps someone from the district social services board, Ontario Works Division, trying to think who else that we would have on our table, but a group of professionals within your community that come together to discuss individuals who are presenting with acute elevated risk, where there's imminent harm for significant psychological or harm, bodily harm, and with the intention on providing the individual with an intervention that will improve that will mitigate risk to the individual. So the OPP does provide the training as mentioned, and so you would come, there are 4 filters with the situation table. There's different filters to allow for de-identified information, and then you would identify whether there was significant risk to move forward. And then ultimately the last step is you would have a very small team who, very small team that's relevant to the situation and that could provide on-scene support and referrals for the individual in crisis. And I'll say individual and or family in crisis. And so sometimes where possible, you know, you would want to have the individual's consent. And you set up a meeting time to go to their home and provide immediate support if that's appropriate, and if they're willing to have you in their home. Sometimes it might be, I have a connection with someone, I work at local CMHA, and they've agreed to meet a small team in my office because they're more comfortable in my office, and we provide immediate support. So we may kind of get a sense of what's happening with that person, and be able to provide them a referral and an intake sooner than later. And sometimes it just helps to really mitigate those immediate risks where there is imminent risk of harm and physical harm to the person. Does that sort of answer?
Great, thank you. I
You're
did
welcome.
questions in the chat, but if it's easier, I can read them out to you one by one as we go through, if that makes it easier, not flipping back and forth.
Sure, sure.
Let me know what works best for you.
Yeah, if you just read them out, I'm afraid if I leave my screen, I'll have a hard time pulling it back up or something will happen.
No problem. So the first one is, what are the biggest challenges faced by the OPP in supporting people with mental illness and addiction issues in the community?
What is the biggest challenge? Oh, it's a great question. That's a very big question also, isn't it? I don't know that I can answer that with one response.
Challenges, so you could do more than one if you like.
Yeah. So I think I feel like one of the biggest challenges might be the need for more funding so that we can provide more training, more frontline training for officers, which ultimately is for our communities. More funding for, say, my position to become a permanent position so that I can continue working on the OPP's mental health strategy. You know, I feel like one of the, if there was enhanced funding that all detachment areas would perhaps then benefit from mobile crisis response teams, which, you know, we hear anecdotally from we've heard from people, so if I go back to the provincial working group, they have done consultations with individuals with lived experience, and that will come when it's released, we hope November, but the feedback has been very positive around for folks who have had interactions with these teams. So I feel like, I know there's still, we've come leaps and bounds when you look at all the parts of Ontario that have existing teams now, but there are still many parts of Ontario that don't have teams. And I think of some of those hard to reach corners of the province, like the northwest part of Ontario, like Greenstone, Marathon, Nipigon. They have these unique geographical challenges, but nevertheless are deserving of health equity across the board. So I feel as though if we had some dedicated funding to those hard to reach areas, that would improve response in the community for people, you know, that are experiencing a mental health and or addiction crisis. So I do feel it comes down to that one of the challenges would be the funding piece. Does that help to answer that question?
Absolutely. The next question, I think you kind of already answered in the first question. And this one, I'm not sure if this falls within the purview of your own role, but has the Black Lives Matter movement changed the way the OPP supports people in the community?
I would say absolutely. I know that currently we are, the OPP is updating and overhauling our mental health policy to include mobile crisis response and police hospital transitions. That's the first key. I also know that we're currently looking at overhauling our CIT training to include this kind of education and include sections on racialized minority groups and to provide even more in-depth training to frontline officers. And I know there have been lots of internal conversations around, looking at ways to improve our interactions with our community partners and the members of our community.
Great, thank you. And I will invite anybody else to add questions into the chat. We'll just keep going through them here. The next one I have is, how does the OPP support youth with mental health and addiction problems?
So again, I know that I won't be able to answer all the questions in that there are several different parts of the OPP that are working on specialized projects. So I can speak to the adult mental health, policy changes and the work on the mobile crisis and the work on our partnerships with the Ministry of Health, our Ministry of Health partners and our mental health and addiction partners in the province. But definitely, I know there is work occurring in other sectors of the OPP towards working with youth. I don't have a list of all those initiatives, but I know there are lots of initiatives that I have heard of within the organization. It just doesn't really fall under my purview, definitely. I can say that there are 2 mobile crisis response teams in the province that are specialized teams to work with youth. And I think the first one is Essex County. And there's an embedded live ride-along model, as well as Kenora has a dedicated youth crisis response team. I know we've had our community safety officers working within the schools for a number of years, but again, those projects don't fall under my portfolio.
Great. The other one I have here, the last one I have in the chat for now, unless anybody else has questions after this, is when the OPP responds to a mental health crisis, is there follow-up in the subsequent days?
Great question. And this is where the mobile crisis response teams have that capacity to follow up, traditionally with the person's consent. The team, so it depends, there are a variety of ways in which a team can follow up. It can be, after the person is transported to hospital, if they are apprehended under the Mental Health Act, the team can seek permission at that time from the individual if it's okay that they follow up with the individual. They may have the clinician call the day after and say, is it okay if we come out to see you, or would you like to chat on the phone? And are there ways that we can connect you to, further connect you to community support? So these teams are invaluable in connecting individuals to services, and there's lots of great follow-up. Some models are follow-up based, like just follow-up models. So it may be that the teams don't respond to live calls for service, but they respond after the crisis has occurred, and they may respond the following day or within a few hours of the incident. So yes, lots of, and then this is where the situation tables can also, if the crisis hasn't dissipated and the person comes before a situation table as being identified as someone with acutely elevated risk, this is also a great opportunity for community partners to respond to the individual as a follow-up to perhaps a referral that has come from police.
That's great. That's a lot of excellent work that's being done. I think that's a big relief for a lot of us to hear just how much work's being done by the OPP and in the community. Before we wrap up, did anybody else have any questions? I'll just give you one more minute in the chat here if anything comes up. And Chantal, we can't thank you enough for being here today. This has been really great to hear about all the hard work that the OPP is doing. It's there are a lot of components to this, and it really seems like the OPP is working very hard to adapt and make sure that they're responding to this growing need for mental health support.
Yeah, thank you. It is, again, I do feel quite proud of the fact that the OPP had the forethought to bring in two subject matter experts from the mental health and addiction sectors. So we'll continue to forge ahead with new initiatives and supporting our detachment commanders, our frontline members, and ultimately our community members to improve well-being and safety for all.
We're very lucky to have you. I want to thank again the OPPVA Chapter 18 Aurelia for sponsoring this event, Chantel for you being here today. A big thanks to Midland Honda and Brissette Concrete and Forming for sponsoring the entire week of sessions. As we said at the beginning, all of these sessions are free and will be recorded and placed on the Waypoint YouTube channel. So for those who weren't able to be here live today, this will be available in the upcoming weeks. We also have the donation link available in the chat. So if you would like to donate to the COVID-19 Mental Health Relief Fund, we would certainly appreciate any support. We also have two other great sessions happening today and a number of sessions happening throughout the week. At 12 o'clock this afternoon, we have Learning About ADHD with Dr. Rob Meader, and that is sponsored by Team Hawk. And at 4 o'clock, we have Zumba with the North Simcoe Youth Wellness Hub. So we hope to see some of you there. Thank you all so much for coming out, and thank you again, Chantel. It was really nice to hear about all the things happening at the OPP.
Great, my pleasure. Thanks, everyone.